Hey there, amazing people. Have you ever woken up, tried to get out of bed, and thought, why does my back feel like it's staging a rebellion against me? Or maybe you've been battling chronic back pain for so long that you're wondering, is surgery my only way out? If that's you, stick with me, because today, we're diving deep into something life-changing: surgical options for severe back pain. I'm Dr. Anna Schneider, a physician who's spent over 15 years helping people just like you reclaim their bodies from pain. And trust me, I've seen it all: tears, triumphs, and everything in between. Here's the deal: today's story isn't just about scalpels and operating rooms. It's about you, your power, your resilience, and your right to live without that constant ache holding you back. We'll unpack the science, bust some myths, and, here's the exciting part, show you how to take charge of your health like the warrior you are. Did you know that over 80% of people will experience back pain at some point in their lives? Yep, you're not alone. But here's the kicker: only a small fraction needs surgery, so how do you know if you're one of them? Let's find out together. Grab a comfy seat, maybe a cup of tea, and let's get started. Oh, and drop a comment below: where are you watching from? New York? Tokyo? Sydney? I'd love to know who's joining me on this journey. Alright, let's set the stage. Picture this: your spine is like the backbone of a skyscraper, strong, complex, and absolutely vital. It's made up of 33 vertebrae, cushioned by discs, and supported by muscles and ligaments. But when something goes wrong, whether it's a herniated disc, spinal stenosis, or a condition like scoliosis, it's like a crack in that foundation. For most people, rest, physical therapy, or medication can patch it up. But for some of you, my brave fighters out there, the pain becomes relentless. It's not just a twinge, it's a storm that steals your sleep, your joy, your ability to chase after your kids or enjoy a walk in the park. So, when does surgery enter the chat? As a doctor, I'll tell you straight: surgery isn't the first stop, it's the strategic stop. The American Academy of Orthopedic Surgeons says less than 5% of back pain cases require surgical intervention. That's right, 95% of you can conquer this without ever seeing an operating room. But for that 5%, surgery can be a game changer. Maybe you've tried everything: pills, injections, therapy, and the pain still has you in a chokehold. Or maybe an MRI shows something serious, like a disc pressing on a nerve so hard it's causing numbness or weakness. That's when we start talking options. Now, here's where my years in the clinic come in. I've held hands with patients who were terrified of surgery, and I've cheered them on as they walked out of recovery stronger than ever. So let me ask you, what's the one thing holding you back from considering surgery? Fear? Uncertainty? Drop it in the comments, I'm here to help you unpack it. Because knowledge is power, and I want you to feel unstoppable. Here's the truth: your body is a masterpiece, and even when it's hurting, it's fighting to heal. Surgery isn't defeat, it's a tool to help you win the battle. Let's explore what those tools look like. Okay, team, let's break this down like we're old friends chatting over coffee. There are several surgical options for severe back pain, and each one's like a key designed for a specific lock. I'll walk you through the main ones I've seen transform lives, straight from my experience in the trenches. Ready? 1. Discectomy, the disc fixer. Imagine a disc in your spine bulging out like a jelly donut that's been squished too hard. When that jelly presses on a nerve, it's agony, shooting pain down your leg, tingling, the works. A discectomy is when we go in and remove that troublemaker. It's one of the most common back surgeries, and here's the cool part: about 90% of patients see significant relief, according to the National Spine Health Foundation. I've had patients tell me, "Dr. Anna, I forgot what it's like to stand without pain." That's the magic of giving your nerves some breathing room. Recovery? Usually 4 to 6 weeks. You're not running marathons yet, but you're back in the game. 2. Laminectomy, opening the highway. Next up, spinal stenosis. This is when the canal your spinal cord runs through gets too narrow. Think of it like traffic jamming up on a highway. A laminectomy removes part of the bone or tissue causing that squeeze. I've seen this work wonders for older patients, folks in their 60s and 70s who thought their walking days were over. Studies show 70 to 85% of people feel better after this. It's not a quick fix, recovery can take a few months, but it's like handing your spine a megaphone to say, "I'm back." 3. Spinal fusion, the stabilizer. Now, spinal fusion is the heavy hitter. If your spine's wobbly, maybe from arthritis or a fracture, we fuse 2 or more vertebrae together using screws, rods, or bone grafts. It's like welding a shaky bridge to make it rock solid. I'll be real, this one's more invasive, and recovery can take 6 months or more. But for the right person? Life-changing. I had a patient, Mark, a 45-year-old dad, who couldn't lift his daughter because of instability. After fusion, he sent me a video of them dancing at her birthday party. Cue the happy tears. Success rates hover around 70 to 90%, depending on the case. 4. Artificial disc replacement, the high-tech swap. Here's the futuristic one. Instead of fusing bones, we replace a damaged disc with an artificial one. It's less common, but it's gaining traction, especially for younger patients who want to keep their flexibility. Think of it like upgrading a worn-out tire instead of locking the axle. Recovery's faster than fusion, and studies, like one from the Journal of Neurosurgery, show 80% satisfaction rates. I've seen this give people their athletic lives back. 5. Vertebroplasty/kyphoplasty, the bone boosters. Last but not least, for those with compression fractures, often from osteoporosis, these procedures inject bone cement to stabilize the vertebrae. I've watched patients go from hunched over in pain to standing tall in days. It's quick, often outpatient, and 75 to 90% report relief. So, which one's right for you? That's the million-dollar question. It depends on your diagnosis, your lifestyle, and your goals. Have you had an MRI yet? What did it show? Share in the comments, I'd love to hear your story. Alright, let's get real. Surgery's not a magic wand, it's a calculated leap. I've sat with patients weighing the pros and cons, and I owe you the same honesty. The rewards. First, the good stuff. The North American Spine Society says successful back surgeries can cut pain by 50 to 80% and boost function dramatically. Imagine tying your shoes without wincing or playing with your grandkids again. That's not a pipe dream, that's what I've seen happen. One patient, Sarah, told me after her discectomy, "Dr. Anna, I feel like I've been given a second chance at life." That's the reward, reclaiming you. The risks. But here's the flip side. Every surgery has risks: infection, bleeding, nerve damage. For spinal fusion, there's a 5 to 10% chance of complications like hardware failure. Discectomies? Less than 1% risk of major issues, but still, it's there. I've seen patients breeze through and others hit bumps. That's why we plan meticulously: MRIs, X-rays, the works. Recovery, your role. Recovery's where you shine. Follow your surgeon's orders: rest, rehab, patience. Physical therapy is your best friend. Studies show it cuts recovery time by weeks. I tell my patients, you're not a passenger, you're the driver. How committed are you to healing? That's the game changer. Listen, you're not a statistic, you're a fighter. Surgery's just one chapter, not the whole book. What's your biggest fear about recovery? Let's tackle it together in the comments. So, how do you know if surgery's your path? Here's my doctor-to-friend checklist. 1. Pain's unbearable. It's not just annoying, it's life-altering. 2. Non-surgical options failed. You've given therapy and meds a fair shot. 3. Nerve issues, numbness, weakness, or loss of control? Red flags. 4. Diagnosis matches. Your MRI screams, "Fix me." 5. You're ready, mentally, physically, emotionally. Talk to your doctor, get a second opinion if you need to. I've guided patients through this crossroads, and it's all about clarity. Not sure where to start? Ask me anything below. Wow, we've covered a lot, haven't we? From discectomies to fusions, you're now armed with the knowledge to take back your life. I'm so proud of you for being here, for refusing to let pain write your story. You're stronger than you know, and whether surgery's your next step or not, you've got this. Here's my challenge, drop a comment. Where are you watching from? Chicago? London? Hanoi? Tell me one thing you learned today or one question you still have. Let's keep this conversation going. I'm your partner in this. Hit that like button if you're ready to own your health, and subscribe for more straight talk health wisdom. Until next time, keep fighting, keep shining, and know I'm rooting for you. This is Dr. Anna Schneider, signing off. See you in the comments.